Last week, the Premier promised that there was going to be a program in hotspots for vaccinating people over the age of 18. We find out, of course, that public health had no idea that this was coming. There were no extra vaccines provided. There were no extra resources provided to public health units. And then Scarborough had 10,000 appointments pulled right out from under them. Here's what one source tells the Toronto Star, and I quote, "They made an announcement without a plan or a supply to implement it. A, there was no supply. B, people couldn't register for appointments. C, there was no plan." What the heck is going on with the government? Why can't they get their act together and protect the people of this province from COVID-19? Because that's their job.
Premier?
Through you, Mr. Speaker, the Leader of the Opposition can get up and shout up and down and scream and do cartwheels. That's fine. The bottom line is, the Leader of the Opposition doesn't understand the process, doesn't have a clue about the process, how it's been working. Again, God bless the people of Scarborough, we're going to get them vaccines. There's 3 million appointments been booked. We don't have the vaccines for 3 million people. It is simple as that. As soon as we get the vaccines, we'll be able to distribute it. We'll be able to get it out to the pharmacies with the AstraZeneca and the primary care. We'll be able to get the Moderna and the Pfizer out to the public health units. That will distribute it to the hospitals. It's not their fault because they have 10,000 additional appointments, didn't have the vaccines. There's only one government that's responsible for the supply of the vaccines. It's not the province, it's not the municipality, it's the federal government. We need the supply of the vaccines. Simple as that.
The final supplementary.
Well, I have news for the Premier. There's a distribution issue here in the province of Ontario, and that's his responsibility. But look, the Premier was warned back in February.
Order.
It is really clear. The warnings came from the experts back in February that we were going to end up exactly where we are now. We have over 650 patients now in the ICU, Speaker, and these aren't just numbers. These are people that are literally fighting for their lives, fighting to breathe, fighting this virus in ICUs. And, of course, places like Scarborough are ground zero, where they're literally airlifting people to Ottawa to try to give them the care that they need. People were failed by this Premier. He failed the people of Scarborough. So my question is, when is this government, when is this Premier going to stop making excuses, stop blaming everybody else, and start protecting those frontline essential workers, those frontline workers in Scarborough?
Premier? You, Mr. Speaker, when the Leader of the Opposition is talking this way, she does a disservice to the public. She does a disservice to our health partners, to the public health units that have been working their back off day in and day out. As the Leader of the Opposition sits there and throws barbs at everyone, when she hasn't even been involved from day one, has done zero, nothing at all to support the system, nothing to help out. As people up in Hamilton are struggling, what has the Leader of the Opposition done? Nothing. We're going to continue to focus on making sure that we get the vaccines. Part one of our plan is to limit mobility to get the ICUs down with the people of this province.
Response.
Part two is we are going into high-priority neighbourhoods. We are going to high-priority companies within those neighbourhoods. As we speak right now, it's happening. We saw it happen over the last 4 or 5 days. We're getting the job done.
The next question, Leader of the Opposition.
Thank you, Speaker. My next question is also to the Premier. Well, I can tell you for sure that I would have been listening to the scientists. I would have been following the instructions of the folks who were the experts who were giving this Premier advice, but instead he didn't. He actually ignored the advice of experts and walked us right into this third wave, which is now completely out of control, with his eyes wide open. There are a number of things that he could have and should have been doing, and I assure him I would have been doing them. I would have been doing them. Now, apparently Cabinet is meeting today.
Government side, come to order.
The Premier, yet again, as the experts have, as his own Chief Medical Officer of Health has, to start providing paid sick days to essential frontline workers, to all workers in Ontario. Start providing paid time off for vaccinations for all Ontario workers so that they can have the tools to do the right thing. And I don't want to hear the malarkey about the federal program. It is not a paid sick day. It's a benefit that you might or might not get.
Members, please take their seats. Premier?
The opposition is doing a disservice every time she stands up and speaks, every single time. She's telling the people that there's no paid sick days. Imagine the people at home listening to this that won't even apply to the federal government sick day program that we fought hard for, that we fought for $1.1 billion, Mr. Speaker.
Order.
There's $700 million. But guess what, Mr. Speaker? We're fortunate that 300,000 people in this province are smarter than the Leader of the Opposition because they did apply and they did get funding for sick pay. So I encourage every single Ontarian not to be double-dipping. It doesn't matter if it says the Government of Canada or the Government of Ontario. There's one taxpayer. There's $700 million sitting there for the people of Ontario to apply.
Supplementary.
Well, Speaker, the disservice comes from a Premier who doesn't want to do his job and acknowledge that people need paid sick days, not a program that you have to qualify for, that you have to jump through hoops for, that you may or may not get access to. Paid sick days occur in the moment.
Training,
you don't have to wait for them. You don't have to worry that your pay is going to be docked and then wait for even a week and a half. You get them right away. And that's why every single expert, not just me, not just the Leader of the Opposition, every single expert has been telling this Premier that those frontline heroes, those essential workers, the people he pretends to care about, the little guy needs paid sick days. When will this Premier do his job and protect those essential frontline workers with paid sick days and paid time off for vaccinations?
Premier?
You, Mr. Speaker, talk about doing a job. Our team, the frontline healthcare workers, the docs, the nurses, paramedics, everyone, have been working around the clock for well over a year, literally 24/7, every single day, trying to support the people of Ontario. And the negative talk that comes out of the Leader of the Opposition, again, does a disservice to all of the frontline healthcare heroes, all the people of Ontario. And it's ironic, it's coming from a person that has done diddly squat, nothing, zero, sat in their seat, and sits there and criticizes the hard work of the healthcare workers and the doctors that give me advice. No matter if it's Dr. Williams or Dr. Brown and the 100 doctors underneath them, or if it's Dr. Davila or Dr. Lowe, that all are giving advice, all working their back off. Why doesn't the Leader of the Opposition do something? Do something positive once in a year and a half, because it's not even in her mindset.
Thank you. This will be the final supplementary.
Speaker, the people of Ontario deserve so much better than this. Folks are losing their lives. People are getting sick at unprecedented numbers. 650 people, 659 actually, in the ICU today, struggling to breathe. The virus continues to grow. Over 4,700 people in Ontario now have the virus. We've given this Premier all kinds of advice. We've asked him, we've begged him to listen to the experts, to follow their lead, to do what they're telling him to do. And instead, he walked us right into this third wave, into this rampant spread of variants of concern. And now, he seems to think that it's not his responsibility, that it had nothing to do with what he did or didn't do, the actions that he refused to take. Take the actions necessary. Take the actions that the experts are telling you to take. Bring in paid sick days, bring in paid vax time, and stop the spread of this virus. Will the Premier do that?
Premier. Premier.
Mr. Speaker, it is so frustrating sitting here listening to the Leader of the Opposition, disrespect Dr. Williams, disrespect Dr. Brown, Dr. Heyer. I could keep rattling all the doctors, all the CEOs that I talk to at least half a dozen every single day, giving advice, and the Leader of the Opposition wants to disrespect them. We have followed medical
Ottawa
advice
South, come to
from
order.
day one. We have followed science from day one. And that is the reason we're doing more vaccinations than anyone.
I'm going to ask the Leader of the Opposition to withdraw.
That is the reason we're leading the country in vaccinations. Bar none, no one even comes close to the amount of vaccinations. We're getting in excess of 100,000 vaccines out a day. And guess what, Mr. Speaker? We have 3,200 pharmacies. We're only at 1,400 pharmacies. We need more supply. We can ramp up well in excess of 300,000. I want to ask the opposition leader a question. What would happen if we would have 5 or 6 million vaccines back in February and March?
Premier will take a seat. Order. The next question, the member for Brampton East.
Thank you, Speaker. My question is to the Minister of Health. There's no other way to say this right now.